So much. I'll just get my screen lit up here. Okay, so hopefully everyone can see that. So yeah, so Bismillah, this is I'm really honored to be here, and I definitely want to thank Migraine Canada for organizing this. This was not my idea. Migrant Canada on their own came up with this idea, and I really give kudos to them for this because I think it is a very important topic. It's one that I never actually thought about as a topic to speak on, but when they had approached me for this, I thought it was a fantastic idea, and I really applaud them for putting this on. So just as a disclosure or disclaimer, although I am a Muslim who observes Ramadan and a migrainer, as well as a headache specialist, I am not a scholar or imam. So when it comes to things like religious advice and issues of jurisprudence or fiqh and things like that, I wouldn't be able to give you a clean answer. The things that do relate to that, I subscribe to the Hanafi fiqh. So anyone who understands that, that's the kind of jurisprudence that I follow. So there would be nuances with different sects and different ways of practicing Islam. So it's important to keep that in mind. And so always contact your local scholar or imam, as well as your local healthcare providers. So what we're going to do today, so we're going to start off by talking a little bit about Ramadan, make sure we're all on the same page, because I know we have people of various backgrounds. The connection of Ramadan and migraines, and some of the more interesting research that's come out in this regard, which I think is kind of as we expected, but really helps confirm what many of us migraineurs feel during Ramadan. And I think the bulk of the talk will be talking about practical tips, so how you manage your medications, caffeine, hydration, diet, sleep, and then probably most importantly, what do you do when you get a migraine while fasting? So I thought it would be good to get an idea of the group that we're dealing with today. So we'll start with the poll question. So the first question is, why are you attending this webinar? And the answers could be that you are a healthcare provider and want to be better informed for your patients, that you are a person with migraine who will be observing Ramadan, so this directly affects you. I'm a family member who knows someone with migraine or chronic migraine, and they're going to be fasting, or you just want to learn more. And the second poll question, what is your current level of knowledge on fasting and migraine? So is it minimal to none, a little, a fair amount, or a good amount? I apologize if you hear noise in the background. Young children who are excited. So I'll give you guys a chance to answer that. And once we have a good enough result, we'll see what we have from there.
We've had 17 of our 20 participants answer. So I'm going to end the poll now, Dr. Hussain.
Sure. Yeah, no, that sounds good. Okay, good. So a really good spread, actually. So the most common is someone who's a person with migraine observing Ramadan, but we've got spread throughout all categories. So that's fantastic. So also gives me an idea that I need to make sure that I keep the knowledge base broad. And then your current knowledge, most people having on the lower end. So I think this is a very worthwhile talk then. Okay, perfect. So moving forward, a little bit of a background about Ramadan. So just to make sure we're all on the same page. So Ramadan this year is expected to start around March 9th. Now remember that the Islamic calendar is based off of the lunar calendar. And so the months shift every year, and every year Ramadan moves back roughly 10 days. And so this year we're expecting to start around March 9th. This is, of course, hugely important time for Muslims. It is one of the 5 pillars of Islam. And so a very, very important devotional activity. And so in most sects or strands of Islam, the fast is from the pre-dawn to sunset, or what we call Fajr till Maghrib. People who are fasting abstain from all food and drink. So that's nothing by mouth whatsoever. And if you look at the pre-dawn to sunset, again, depending on where you live in Canada and the day of the month, as that obviously will shift as you get more and more closer to summer, hours get longer for sunlight. You're looking at typically somewhere between 5 to 7 a.m. as the start of the fast until about 7 to 9 p.m. to the end. And again, that very much depends on where you are. Now, there are some people who will fast till absolute darkness or Isha prayer, and so that would be even later. So you kind of have to keep that in mind that we're looking at a minimum of really 12 hours of fasting during the daytime. And so people who fast will typically have two main meals. There's the sahur, or the pre-dawn, pre-fast meal, and iftar, which is the breaking of the fast, which occurs at Maghrib time or the sunset. Overall, Ramadan is not just about fasting. It's a month to get closer to God through fasting, community, acts of charity, good deeds, and prayer, which includes the night prayer and the night vigil. So this is an important, and the reason I bring this up is because it is actually important to understand what this entails for those who participate in this, because this does affect some of the things that we're going to be talking about. And so that during Ramadan, and for those of you who live close to a mosque or have a mosque close to your house, and are not a practicing Muslim, you'll notice that in Ramadan, in the late nights, the mosques are completely packed. And that's because after Isha prayer, so that's after complete darkness, so people break their fast, around 7 to 9 p.m. There's usually about an hour gap between that and the last prayer of the day, which is the fifth prayer. And after that, there's a voluntary prayer that many people will participate in communally. And that lasts anywhere from 1 to 2 hours. It can be a very slow, melodic kind of prayer. And then there's another prayer that can occur prior to the pre-dawn meal. So waking up earlier, even earlier than 5 a.m., maybe even 4 a.m. To pray X amount. And that can be variable from just 5 minutes up to an hour, depending on the person, even longer. And so that can affect sleep quite a bit. And so this is an important thing to understand. And you'll have to manage for yourself or for your patients who are going to be participating in these types of activities. For further background, because I'm going to be mentioning some of these terms, I just don't want anyone to get lost. So in terms of the Islamic calendar, right now we are in the month of Shaban, which is the month before Ramadan. And Islamically speaking, Shaban is often talked about as a month to prepare ourselves, body, mind, and soul, for Ramadan ahead. And this is really, really important for this talk in particular. So we always think about Shaban as a month where people are a little bit more relaxed because they know Ramadan's coming. They're kind of saving their energy. But in reality, what we should be doing is preparing ourselves. And this holds extremely true for those who are migraineurs. So it's recommended for people to have voluntary fasts, increasing their prayers and recitation of Quran, things like that, so that they're getting ready for Ramadan. And in the same kind of vein, from a spiritual perspective, I think physically it's very important for people with migraine to prepare themselves for the coming month. And so this is a good time to have this talk, and to hopefully we can give you some tips on how to manage that. Now, a little bit about migraine. I'm not going to explain the complex diagram on the right, but that's a very classic diagram people use to talk about migraine. The real key thing that I want to focus on for people is the hypothalamus, which is this center here. There are many different structures that are important in migraine, but hypothalamus is critical. And one of the most classic phrases that I've heard and I love, which I always repeat to anyone who knows me, and this will come up a lot during this talk, and I think really explains everything, is that migraine brains don't like change. I think this is the most important way of looking at things. And so if you think about that, if you think about triggers for migraine, that it all relates to change. And hypothalamus is really important for homeostasis, so keeping things balanced, keeping things even. And so when there are sudden shifts and changes, this can trigger migraines. And those sudden shifts could be from weather, so barometric pressure. So a lot of patients will tell you that, they're a human barometer. They know when the storm is coming before the weather actually starts. Stress changes, hormonal changes, particularly in women with the menstrual cycle. Caffeine changes. So we know that we used to think of caffeine as kind of if you take too much caffeine, it can cause migraine, but that's not actually what the evidence suggests. The evidence probably suggests more that caffeine, it's all about staying consistent. So if you drink 1 cup of coffee every single day, it's probably not going to trigger a migraine. But if you drink one day, 3 the next, and then 0 the next, that's what's going to, that fluctuation, that change is what's going to trigger a migraine. Same thing with sleep. Most migraineurs, myself included, I know that if I don't sleep well, either sleep too much or too little, that can trigger a migraine. Diet, same thing, particularly when it comes to things like glucose levels, unprocessed foods, unhealthy foods, all these kinds of things. You just suddenly splurge, that can trigger a migraine. So there are many, many things that come into it, but many of these things that we just mentioned, so particularly the last 3, caffeine, sleep, and diet, are all things that dramatically change in Ramadan for the person who is fasting. So without preparation, Ramadan would then result in a sudden and dramatic change to your system, and obviously then cause migraine. And so what do we know about Ramadan migraine? So these are 2 studies that were done in the last few years. So one out of Kuwait and one out of Egypt. And I'll just kind of mention them briefly. So the Kuwait study just kind of showed, not surprisingly, that people with migraines have an increase in their headache. So for the cohort that they looked at, the average person had 6.9 migraine days leading up to Ramadan on average. During Ramadan, the average was 10.4. So it increased by about 3.5 days per month. I think the more important study was this one in Egypt, and this actually won the American Headache Society Paper of the Year award last year. And so they showed in their cohort, it just increased from 3 to 4, which again shows an increase. There obviously were people who had a little bit less migraines compared to the Kuwaiti group. But the most important thing were the next 2 points, which is they looked at it on a temporal basis, so every single day of the month and when people got their migraines. And what they found was by far most of the migraine attacks occurred within the first 10 days of Ramadan, and then things settled. And 53% of people had migraine on day 1. And I think most of us who fast and have migraines know that day 1 is often the hardest day. We often are, struggling to get to the breaking of our fast because the migraine starts to kick in. And so this just, again, emphasized that same point that I was mentioning earlier, is that most people don't plan ahead. And what we're seeing are sudden changes to your medications, to caffeine, hydration, to diet, and to sleep. And so it makes total sense that it takes roughly 10 days for your body to adapt to this change. And that's why most people will have migraines in the first 10 days. And so the obvious conclusion then is, if we prepare ourselves before Ramadan, hopefully then you won't have this gigantic surge in migraines. And I've been doing this for the last couple of years, actually. And I have noticed that if I've made sudden changes or subtle changes throughout the month of Shaban, I definitely have found that my migraines in the beginning of Ramadan are significantly less. And I typically get about 1 now when I first start fasting the first few days, but that's about it. But here's some practical tips. So this is an important question for those who are on a preventative medication. So this is just for daily medications. It's important to know that oral medications cannot be taken while fasting. So anything oral, whether that's medication or not, cannot be taken without constituting breaking the fast. It's important to discuss this with your physician and look at ways of managing this and getting around this. So for example, if you're on a once-a-day medication, which many of our preventative medications are, your options are basically to take it at your pre-dawn meal or in the evening. Obviously, preferable to take medications like amitriptyline, which can be sedating in the evening times. But you may want other medications that, perhaps don't have those side effects to be taken in the morning. And again, you can work with your doctor on what would be the best for you. For twice-a-day medications, that come simple. Obviously, you take one at the pre-dawn meal and one at iftar. 3 times a day can be tricky, especially with these longer hours. And so as we go further on in Ramadan, it stretches longer and longer. So 3 times a day is probably not going to be doable. But do understand that if you talk to your doctor, there are some medications, like for example, if you're on gabapentin or Diamox or acetazolamide, that can be changed to twice-a-day dosing, but that'll need to be done, again, with the help of your doctor and to make sure it's dosed correctly. So there are alternatives and options for you. So hopefully just by the fact of you taking medications on a regular basis shouldn't be a reason to necessarily stop you from fasting. What about things like injectables? So less frequently taking treatment. So this can include things like Botox injections, your CGRP monoclonal antibodies, nerve blocks, and things like that. Anything that is an injectable, whether that's subcutaneous, intramuscular, or even intravenous, are mostly considered to not break the fast. And again, this is I'm speaking from the perspective of the Hanafi fiqh. So again, if you are of a different fiqh or a different sect of Islam, please speak to your scholar about that to clarify. But generally speaking, based on my understanding and this fiqh, that is acceptable and would not break your fast. The exception to this would be SPG blocks. So if there's anyone who are getting sphenopalatine ganglion blocks, because of the fluid, then when you're squirting it into your nose, essentially, it will go down and you will swallow it. And so again, that would, because it's essentially by mouth at the end of the day and going down your throat, that would constitute breaking the fast. So that would not be something that you could do. But if your nerve block or your Botox appointment or whatever, if you're on a monoclonal antibody, falls within Ramadan, there's no issue with you getting those treatments done as you normally would. What about as needed medications? So we're talking about abortives now. So, medications used to stop migraines when they come. So obviously any oral, and then just as I mentioned earlier, even intranasal sprays would constitute breaking your fast. So that's non-steroidals, Gepants, triptans, whether they're oral or intranasal, it would be constituting breaking your fast. However, as I mentioned earlier, injections would not break your fast. So if you were prescribed, for example, a subcutaneous sumatriptan or a ketorolac, that would be considered acceptable and would not break your fast. And then there's lots of other options outside of medications, right? So things like topical creams, oils, and the consensus for the fiqh that I am coming from, which is the Hanafi fiqh, that would not break your fast. So, and I will talk again more detail about what to do when you get a headache, but this is just kind of general kind of ideas of the treatments and medications that you might be on. So what about caffeine? So this is something that I've been experimenting with myself for quite a while now. And so I feel like I have at least a personal experience for this. There's no real literature to back this up, but this is my own personal experience putting it out there. So it makes sense that this is in my opinion, probably one of the most common causes of the headache in day 1 or 2. As we all know, sudden changes will trigger headaches. And so what I recommend is trying a slow wean during the month of Shaban. So I've already started my wean personally. I typically drink 1 to 2 cups of coffee per day. And so this would be like a sample schedule. Okay, so for someone who drinks 1 to 2 cups of coffee, so that's like me, this is how I would recommend doing it. So if you had 4 weeks, we don't have 4 weeks now, we're closer to 2 to 3 weeks. But if you had the 4 weeks, I would start with 1 cup per day for a full week. So I was saying no to any evening tea, coffee, things like that. Maybe the occasional splurge, but trying not to. Then week 2, you can alternate with 1 cup per day and 1 half calf. So you can either, if you're grinding it yourself, you can mix decaf with calf. If you use an espresso machine, they have half calf pods. Same thing with Keurigs. So try to do more half calf. And then gradually do only half calf, and then gradually mixing in decaf. Because remember, decaf also contains caffeine, although much lower levels. It still has some caffeine. And so it'll still get you through a little bit just to kind of, again, slowly wean you off until the point where you're only on decaf. And then you could either have it 1 or 2 days before Ramadan where you're having none, or even if you stopped with just decaf, you should be okay. Now, I know that's not possible for everyone. So if it's not possible, try to reduce gradually, as I mentioned earlier, in that kind of similar fashion. And then you can always have a small amount of caffeine at sahur or iftar, whatever works better for you, especially in the first few days as you're kind of continuing to wean off of it. But the key thing again is making sure it's keeping it consistent. And if you are going to change it, as we're going to do in Ramadan naturally, then try to do that gradually and not suddenly. That's the key. The other thing I always tell people, because people often forget this, is that green tea has a very high caffeine level. So if you're thinking that I drink green tea every day, so I'm fine, I don't need to worry about that withdrawal, green tea does have actually very high caffeine. In fact, it has higher caffeine than some coffees. And so you need to be careful with that. So hydration. So this is really important. It's very common, and many people will tell you, particularly when it was a few years ago when Ramadan was in the summer, dehydration was one of the bigger kind of difficult parts of Ramadan. It's very, very important that you drink lots of fluids, your pre-dawn meal, your iftar, and particularly when you're up at night prayer. So if you're in tahajjud or tarawih prayers, ensure you're drinking lots of water throughout that. And if you can't drink water, you don't like water, electrolyte drinks would be fine as well. But definitely avoid juices and sugary drinks. I know people from the Indian subcontinent love brew afza, but it's a really good idea to avoid that as much as possible because that is going to cause significant fluctuations in your glucose levels, which the spikes and drops of that will trigger migraines. So really important to try to make sure you're maintaining that. If you're having dates to break your fast, that's totally fine. But if you're having dates with sugary drinks, with all the other sugars, that's when you start running into problems. And coming to diet. So obviously, I know that culturally speaking, across all the cultures around the world, we celebrate Ramadan. Food is a big part of Ramadan. The iftar feast, coming together as a community, potlucks, it's a big part of Ramadan. And so I don't want to, be kind of, the Debbie Downer here and make people not eat nice foods. But, at the same time, it's important to make sure that we're smart about this and that we're not going to, suffer from that. So really try to avoid foods high in processed sugars, refined carbs, or fried foods. You're always good sticking with things that are local, organic, natural. And really the key thing, I think, particularly for sahur, so the breakfast meal, but any time, with iftar as well, you want to try to stick with things that are more slow release energy food. So not like that refined high sugar content, but more things like proteins, things like lentils, nuts, beans. If you're going to have rice and bread, have brown rice, have whole wheat bread. I personally love overnight oats it's fantastic sahur. So I usually have overnight oats with some chia seeds, just like in that picture, with some fruit, typically berries, and it's a phenomenal sahur. And often I personally don't feel very hungry. I drink that with lots of water. I have that with lots of water, and I don't usually feel much of the fast. So that slow release energy foods will help you get through the fast, but also ensure that your blood sugar levels and things are reasonably stable throughout the day, not triggering migraines. What about sleep? So as I mentioned, there are significant changes in sleep schedule, and again, this is variable depending on each individual person and how they're practicing during the month of Ramadan. So there are some people who throughout the entire month will be waking up early for Tahajjud prayers, will be going to Tarawih at the mosque every night, and others will do it sporadically as they're able, depending on their work and other things. So it's important to keep this in mind and think about how you need to kind of gradually again change this for Ramadan. Naps are something that people like to do in Ramadan. It's again, as I mentioned, for those of us who are lucky enough, because for example, if you've got kids or you're working, it's not always possible. But sometimes, particularly if you're going to be up late and you're going to be up early, a nap is not necessarily a bad idea. The key thing with naps, though, try to keep them short, ideally like a cat nap. So, somewhere in the 30-minute range is ideal to try to just give you that boost of energy. And, particularly if you're having issues with migraine, which we'll talk about in a sec. So some suggestions. You can start doing some night vigils early. So if you're planning on doing it throughout the entire month, I'd recommend start doing some even during Shaban. So if you're going to be doing Tahajjud prayers, waking up early, start doing that, and then maybe go back to sleep after the pre-dawn prayer. And so that at least you're getting somewhat used to waking up at that time, and your circadian rhythm, which is that normal rhythm that you have in your body for daytime and nighttime, will start to slowly adapt to that. Another trick that some people mentioned, if you're already waking up early, and right now, Fajr prayer, which is the morning prayer, is relatively late, so it's a time that you would normally wake up at. Not a bad idea to start waking up maybe a little bit earlier and earlier and earlier, so that you're getting closer to the time that you would have your pre-dawn meal, and so that again it'll be a gradual change to Ramadan. What about exercise? So this is another thing that's really important. So for those of you, particularly those of you who are very active, don't neglect exercise, because again, if you are very active and then you suddenly stop, the changes that can happen to your body again could trigger migraines. So I recommend continuing it. I personally love to exercise right before iftar time, or some people like to do it in the morning, again, before sahur. So I would strongly recommend any kind of physical exertion before a meal as opposed to after a meal. So if you, for example, did sahur, you prayed and you started your fast and then exercised, you're putting yourself in a precarious position, because if you're getting dehydrated, if you're getting, your muscles and everything are sore, tired, you need a little bit of protein, you won't be able to do that. So it's very important to do this before an opportunity to eat. And so I personally like doing it before iftar, but whatever works for you, maintain it. But again, at this time, I would say overall keep it relatively light. Do not overdo it. You probably don't want to be getting into too much anaerobic activity. Keeping it simple, a little bit more of the kind of low aerobic type activity would be ideal. But if you want to obviously keep up some, if you are someone who lifts weights and wants to maintain that, a little bit of that just to maintain things as opposed to gaining would be not necessarily a bad idea. All right, so the last bit of this talk, before we get into Q&A, I want to make sure we have lots of time for Q&A, which it looks like we will. What do you do when you get a migraine while fasting? So I'm going to borrow this from Christina Lay, the Canadian Headache Society. And so, for those of you who are not familiar with this, this is a really fantastic, idea for patients to take home and very easy to understand. So if you're not familiar with this, I think it's a great idea for you to have for your migraines in general. And this is in relation to, acute therapy. So when you get your headache, stopping the migraine. And so you kind of break it down to 3 traffic lights, so green, yellow, red. Green means I can go, meaning you can keep doing your normal activities, you're otherwise fine. And in these scenarios, you want to use kind of simpler options, treat early, and kind of leave it at that. If you're a yellow light, that means you're kind of having to slow down. You're not able to do your fully normal function, but you can do some things. This is a good option to reach for your main treatment option. So that's whether that's your triptan, that's your G-pants, whatever it may be. And then the red is like you have to stop or you wake up with a migraine. And if that's the case, that means you're at a very severe migraine. Make sure you hit it hard. Combination therapies is the best way to do it. But again, you want to make sure, particularly for those who have chronic migraine, that you're not overdoing it with medication overuse. So this is kind of the background. That's I think, a fantastic option for anyone who's not familiar with this. I'm happy to kind of promote it here again. But I thought I would use this in a Ramadan way. So kind of the Ramadan addition to the traffic light CHS guidelines. And so think of green as, again, the same thing. I can go, I can keep going, but my migraine's starting to build. At that point, I would use all the conservative measures you have that would not break your fast. And we'll talk about all those things. If it's, I need to slow down, I think the big question then you have to ask yourself is how long is left and can I make it? If you're early on in the fast and you're really having to slow down, that might be a suggestion that you might need to break your fast. However, if you're right towards the end and you're just starting to slow down and you only have like a couple hours left, it might be reasonable to try the conservative measures and see what you can do and try to get through it. So that's kind of that in between. And then if you really are in the red stage and severe or you're woken up with the migraine after, you're early in the morning and you have the whole day to go, I think it's probably a good idea to break the fast at that stage with your typical oral abortive options or subcutaneous or whatever you have. And remember that if you're breaking your fast for a medical reason, and this definitely would constitute a medical reason, it can be made up at a later time. So as a one-to-one. So there's no, you're not supposed to fast technically if you're sick. So if you are unwell, it's a good idea to break it, take your medication, and it can be made up at a later time. So what treatments can you do without breaking the fast? So as I alluded to earlier, if you are prescribed injectable options like sumatriptan, ketorolac, those are things you can use. Now, obviously, not the vast majority of migraineurs, I should say, probably don't have these options, and that's for a good thing because these are really reserved for people who are more severe or more chronic migraines or more refractory migraines, so not responding to typical treatments. But there are tons of other things that people do, right? So there's, a lot of people know about ice or heat and kind of putting it over the neck and back to the head. That's totally reasonable. Consider trying that. For those of you not familiar, I'm sure some people have heard of this. Peppermint oil is a great option. If there's anyone out there who has responded to nerve blocks in the past, peppermint oil will essentially do a similar thing, just not to as a bit of a degree as a nerve block. And I always just take, what I recommend is you take it. If it's a one-sided headache, focus on the one side. If it's bilateral, both sides, do both sides. And essentially just follow the hairline all the way around. And that way, the peppermint oil will essentially target all the nerves that you're hoping to target from a headache. Be careful. I always say be careful with getting it too out down on your forehead. If it gets to your eyebrow and into your eye, it can really start to burn. So just be careful with that. There are a lot of other topical preparations that you can use. I have my own concoction that I've kind of borrowed from our colleagues in Calgary, which is a combination of gabapentin, diclofenac, and cyclobenzaprine. It's a cream. You have to get it made, kind of specially formulary, but the pharmacist can get that for you. And whatever your doctor uses, it's worth a try, particularly if the neck is a big part of your migraines. So if you're getting a lot of tightness in your shoulders and your neck as part of your headaches, you can try that, and that might help settle things down for your headache. For those of you who use nerve stimulators, obviously that can be used. So the Cephally device, which you can buy pretty much anywhere, it used to be sold at Costco, but unfortunately they don't sell it there anymore. But I think you can still get it from Amazon. And that's a supraorbital nerve stimulator, so just over the forehead. And then there's also the Gamma Core, which is for the vagal nerve stimulator. So those are both things you could consider trying. If you're already using them, totally use them during this time. And then don't forget that one of the most powerful abortives you have is sleep. So if you're able to, if you have the option, taking a nap is definitely something you can do, and obviously can help get you through the migraine. Now, obviously, then if you need to break the fast, you need to break the fast, and that's an important thing to think about. And in our religion, God is forgiving, and if you truly are having a bad headache, it's very much within the realm of acceptability to break your fast in that scenario. And then there's the more complicated scenarios, right? So what about people who have like chronic daily headache or chronic migraine or other forms of chronic headache or chronic pain? And I think these are individual discussions that need to be had, and these are really needs to be decided on an individual basis, and no one scenario is the same. And so this is something you really need to talk to your physician and your local imam about. And you really need to start questioning whether fasting is a good idea or not for you this year. And I know that's hard, and I know there's lots of people who struggle with this, because they have that yearning, they want to fast, they want to be devotional in that way. And many of the scholars I've spoken to talk about how just that yearning alone proves that you'll get the benefits from this Ramadan. So don't despair in terms of God's forgiveness, and have that discussion, because there are many scenarios where it's totally reasonable not to fast that Ramadan. And if it is a scenario where you think, for example, that you just haven't gotten the right treatment up to this point and there are other things being tried, perhaps with a headache specialist, the fast can be made up at a later time when your headaches are under better control. So let's say theoretically you're working through something like Botox injections, you just started and you're not sure if it's going to work or not, but you're only on the first cycle. You need to give it 3 full cycles before you really know how it's going to work. But your headaches right now are daily, they're severe. Totally reasonable to say, I can't fast this year, but I'm going to try to hopefully make it up, inshallah, at another time. And if it doesn't get that way, then there's always the last option, which, for those, and there are many people who are like this. If you're unlikely to ever have good control, and I would talk about that with your headache specialist, there is always the fidya, which is kind of that compensatory charity for those who have chronic illnesses and are not, who are deemed kind of medically unable to fast, because that is definitely one of the exemptions for fasting. So if you do have chronic migraines or chronic headaches that have not responded to many, many different therapies, it's very reasonable to consider the fidya. And again, talk to your imam, talk to your headache specialist, and try to come to a good conclusion that is best for you.